Hello everyone, my name is Robyn Vallenilla, and I am a physical therapist that works with the team at Orlando Health at the ALS Comprehensive Care Center. And I'm sorry that I missed you at the Hope and Help Symposium this year, but I am grateful for the opportunity to record this presentation and get the information out there for you guys that I was hoping to. So let's get started. I am going to talk about mobility, but specifically how your mobility and how you move can affect your ability to communicate and kind of the things and the considerations that we need to make and need to be brought up when you're in your therapy sessions working alongside your speech therapist. So I know you guys listened to Rachel give a wonderful lecture on augmentative communication for ALS, and so I'm hoping that this lecture will coordinate with hers as much as possible to kind of give you an idea of how we work together and how it can be important to have physical therapy with even if the concerns that you're having are communication and you might think it would only be speech therapy. All right, so let's get started. So first of all, I just wanted to go over what a physical therapist assesses. So kind of all of these topics that I've put here are pretty general. If you go to a physical therapist with really any issue, what we kind of specialize in is being musculoskeletal and movement experts. So we're going to take the perspective of looking at your posture, your strength, how you're able to move, those big body movements like walking, balance, getting in and out of a bed, what kind of mobility needs you might have, what devices you might be using or what you might be needing, and then also what your home environment is set up like, what your lifestyle needs are. So that's kind of the perspective that we're taking, but what I'm hoping we're going to kind of see through this lecture is that those topics and those perspectives can be applied to a lot of different parts of our lives, including our communication and our access to be able to use different methods for communication. So how exactly does your mobility affect your communication? Kind of a big one and a word you'll hear a lot if you speak with a physical therapist or an occupational therapist, and probably speech therapy, is posture. My goal in physical therapy would be to help you get the postural support you need, and we'll go through some of the ways that we can do that in this lecture. Your cardiovascular health and your respiratory endurance are also important needs that need to be addressed if we're talking about your ability to communicate and interact in your environment. So we'll go through how you can work on those and how therapists can help you with that. Choosing device and placement. Most of the time, if we're talking about a communication device, you're going to be working with an ATP or assisted technology professional, and a lot of the time, speech therapists are going to be the prime people who will make the recommendations for communication device, obviously, as they're the experts. However, physical therapy can help and make recommendations to the therapist about how to use those devices effectively in terms of being able to move your body to be able to use those devices. So I'm hoping to go through some of that with you guys. Lifestyle needs. So everybody has different hobbies, different help at home, and so we'll go through what considerations need to be made depending on where you are and what stage of your disease that you might be in. And then ultimately the number one important thing is going to be your comfort and your preference. So we always want to take that into consideration too, because if you're not on board with what our recommendations are, there's you're just not going to use the devices or do the exercises or follow through with anything if it's not to your comfort or something that you want to participate in. So that's a very important component. Okay. So let's first talk about posture. What is good posture? So this is just kind of a very general picture of just when we're talking about posture, what do we mean? So if you're standing and walking still, we are kind of looking at this third little standing man here. The key here is kind of that straight line from kind of your ear on the side of your body through your shoulders, down to your hips, and down to your heels. Your spine does need to have curves, as you can see here. However, we just want to make sure that it's an appropriate level of a curve because that allows your chest to be open and for you to take in big, deep breaths like we'll talk about later. And it just allows your body to be at its most efficient for walking. The position, this good posture position, really truly uses less energy than if we're in these more poor posture positions. So that's really important. And then here on the right, even in sitting, it's the same type of thing. If we're in really slouched positions or not getting enough support in our seated posture, we're actually using more energy to be sitting. And so it's really important that we are supported or sit with nice upright posture. So that's kind of an example of what we're talking about when we're talking about good posture. So let's talk a little bit about how we can help with positioning. So with these devices here that we'll go over, I'm really speaking about your seated posture. If you're in a wheelchair or some other kind of seat that you spend a lot of time in, there are a lot of pieces of equipment that can provide you with that extra support. So first up here on the left is the positioning backrest. We can make adjustments to these backrests. Some of them have little fasteners in the back where we can tighten and give you a little bit more of a curve in your back if you need it. They also have support on the side of your body that kind of hugs you in tight and kind of keeps you in that nice secure spot. So that can be really helpful if you have a harder time or you get really tired and kind of start to slouch when you're sitting. And then also if you like to utilize your wheelchair to tilt back, it provides nice support so that even when you're tilted, you're still getting that support in your back to keep the curves that we need to have there and keep your chest open. Here next is a chest strap, so we can utilize the chest strap not only to help keep you upright if you have a hard time and you might be falling forward, if you kind of lack some of the core strength to keep you upright, but also to give you a little bit of support under your chest and kind of at your rib levels to kind of help maybe with being able to project your voice. We can kind of work with speech therapy to see if that can be an option to kind of give you a little bit of help with producing some speech. Then we have a head support. So it is really important to have your head in a good upright position as well as give it some support so that you have some leverage maybe when you're trying to speak. And also if you are fatigued, you can lean back and kind of it will support your head and keep it from just flopping forward if you're getting a little too tired. So that's important. And then finally we can add, I know I said the backrest of the wheelchair had some support on the side, but if you need additional support and you're really tipping over, that's really going to compromise your ability to take in proper inhalation or breathe in. And kind of get that full deep breath that you might need. So these little lateral supports here can help to give you that support and keep you in that nice centered position. Next, we're going to talk a little bit more about where your pelvis, or like where your hips are positioned, because we call that area of your body your core for a reason. It's kind of your platform, especially in sitting. It's what provides you with the most stability. So we want to make sure that you're positioned evenly on each side of your bottom. That if you are sitting for really long periods of time, you have pressure relief on your bottom, and also that you get enough support that you need to have a little bit of a curve in your lower back, and not be kind of rounded sitting right on your bottom bones, because that little pelvic movement there can really help with that sitting nice and tall and upright, to be able to expand your ribs and take in a full breath. So that is very important. We also can utilize a positioning belt. It looks just like a little seat belt, and really that kind of is what it is. It'll help you keep you in your seat and make sure you don't kind of fly out of it if you're driving too fast. But also we can use the belt with a little bit of tension to kind of help keep your pelvis in a position that we want it to be in, like I said, to kind of give you that base of support when you're sitting. And then these little thigh positioners here, those are important because, some people have a tendency to lean to one side or have their hips kind of pop out to the side, which again will cause the upper part of your body to kind of cave in or have what we call a scoliosis curve to it, which again, all of that is contributing to compromising your body's ability to take in enough breath support, as well as expand your ribs. So that's kind of where that those positioners can come in handy. Next, we'll talk a little bit about exercise. So I get asked the question a lot, is can exercise actually help with accessing and using a communication device? And the answer to that is a yes. Exercise is very important to help you build endurance. So if you're exercising, if you're having to breathe in deeper when you're doing your aerobic exercise, that can increase the amount of air that your body is able to take in at one time and process, which can ultimately help with your ability to produce air for speaking. Strengthening and the flexibility in your shoulders and your upper back are really important things to address if you're having trouble with posture. And even if you're having a hard time with active movement or being able to move your body yourself, we can use passive movement and stretching to address tightness that you might have. So using leverage, using gravity to help us, using the way that we position ourselves to get some flexibility back. So all of those things you can be taught to do to kind of help support getting into a better posture, whether that's standing or sitting. Strengthening and relearning how to engage the core muscles is also really important to provide that breath support we've been talking about, and also to give your body that stable surface to work from. Your core, like I said before, it really is, the tree trunk of the body, and it is what provides you with the stability to be able to utilize your extremities, but then also project your voice and get in enough breath support. So it is really important. And like I said before, sometimes it's even just learning how to engage the deeper core muscles that no one has ever educated on. That can be really important to kind of give your body that support. And then we talked a little bit about flexibility of the shoulders, but also the back of the neck and the front of the neck can be really important for depending on the devices that you're using, or even just to be able to open your mouth enough for speech. And so depending on where you are at in your disease process, a lot of times, working with just light flexibility or positioning of the neck, making sure that they have the range of motion there can be really important to support using communication devices.